essentially, I think most people will be very surprised to learn that their NHS has almost no idea at all about the quality of the care they've received outside of its hospitals. There are some glimpses we have into the quality of care received by patients in primary care and some in social care, but they are glimpses. Indeed, the level of insight we have into hospitals is also, frankly, limited. So what we urgently need to do is to build the ability of the local health economy, the local health and care economy, to have real insight, real knowledge of what happens to its patients. And our first port of call is with general practice. There is a real urgency about linking general practice data with hospital data. There are people who are being harmed because we don't have insights into what happens to them along that journey of care. But we can also see the benefits for linking that journey to journeys into community services, into social care, mental health as well. So we want to move as quickly as we can to developing an insight across the entire journey a patient will take through care. But our first port of call is with general practice, because we can see some very important, urgent need for us to be able to plan services better at the interface between general practice and hospital treatment.
I think in terms of new data, what's exciting as a doctor and a medical researcher is the idea of linking up data across someone's life course, right from before their mother got pregnant, through that pregnancy, to the newborn baby, through their childhood, through their education system and everything that happens to them, and then into employment, and in turn, those people becoming parents, and in turn, those people becoming grandparents. And really the idea of being able to study people and populations across their whole life course and across generations, I think will provide insights that we're only just beginning to touch on, really.
What we'd really like to try and find is a patient experience measure that we could build into our data set. And so we've done some work around the patient activation measure, or PAM score, which is used quite a lot in the US. And we've done some work around the new questions for patient experiences of integrated care. I think experience locally, particularly with one of the local mental health trusts, is that actually patients don't mind you connecting this data to their identifier if they think it's going to be used to improve services. So one of the challenges that we anticipate is that people want their experiences to be measured anonymously, but actually, well, I think we're hoping that we might be able to, at least for some patients, build that in as well.